Great. Thanks, Morgan. We're really excited to be here. My name is Zach Goss. I'm joined by Sean and Sven, as Morgan mentioned, and we all represent the Department of Vermont Health Access. And like Morgan said, we connected around just some general questions about the options for small businesses in Vermont. And we saw this opportunity to really share information, put together a presentation that hopefully can help everyone on the call, and then as Morgan said, can be shared further afterwards. So I think what I want to do is I'm going to go over the agenda. Morgan, if you could just go to the second slide, and then kind of summarize what we're going to talk about today and what we had in mind. So we want to just kind of do a high level dive into what health insurance for small business is in Vermont, kind of the 101, the basics. Jump into some basic important terminology when it comes to health insurance and when you're talking about it. Talk more about what's going on for 2022, what's changed, so what's different for 2022, how you can get started, some important dates, and then go into the Q&A. And I think that, and Morgan, I don't know how you want to do this, if you want people to type in the chat, but we want to make sure that you leave this meeting, this presentation feeling like, you got what you came for and like it was beneficial for you. So if that sounds good, if this agenda sounds good, great. If you have other things that you'd like to make sure that we touch on, maybe put them in the chat, or you can come off mute and mention them now, and we can make sure that to address those things throughout the presentation today. So I'll just give a minute in case anyone wants to share additional thoughts.
Zach, we're seeing any chance we can talk a bit about offering HSAs? Yeah,
I think we can definitely talk about HSAs. I think Sean will probably be able to elaborate on that, and we'll talk. We're gonna kind of dip our toe into the water in the introduction, and then certainly as we go through the presentation into the Q&A, we can discuss that. I think one of the things that I'll mention is that we are the kind of the experts on what's offered through Vermont Health Connect and through the state of Vermont, through the Department of Vermont Health Access. We certainly can add some insights into kind of beyond that, but we don't want to kind of speak out of turn there. So see, there was another one, Morgan, that went away on my screen. Maybe you can read it.
Could you please respond to employer assistance for premiums allowed by QCER, but then counted as income by the state?
Absolutely. Yeah, we'll definitely touch on that.
Great.
So
Zach, really quickly before I think one thing that's really important about today's call is that this is the first touch, right? Like this is the first time we're meeting. I think if we decide that there's another meeting that we should hold out of this meeting, or a smaller group, or we can do that. The other piece is that all of the resources that we're able to connect you all with today, we'll make sure that you have access to those in the next few days. So yeah, this doesn't have to be, we don't have to hit everything today, because there's obviously a little bit more time for us to dot I's and cross T's as well. So, but we'll try to cover as much as we can.
Absolutely. Yeah. Thanks for mentioning that, Morgan. I think that's really important. We want to get you the information that you need. So that's definitely our goal. Okay. So yeah, you can go to the next slide. So jumping right in. So small business 101, in terms of health insurance in Vermont. So we wanted to make sure you're kind of aware of these three broad options, and we're going to dive into a little bit more depth. But basically, these are the things that we're hoping people consider when they think about health insurance as a small business. So the first one is a small business can go directly through the insurance carrier or insurance company and buy their small business plan, without involving Vermont Health Connect at all. Some of you may do that. Some of you may have experience doing that. So that's kind of number one. Number two is what one of the guests just asked about. The acronym QSEHRA, otherwise known as QCERA, Qualified Small Employer Health Reimbursement Arrangement. So it's a little less complicated if you just kind of take the qualified small employer off the front of that, but it's an HRA, it's a health reimbursement arrangement that is another option for employers to help fund healthcare options for their employees. So we'll go into that. And then the third one is that individuals can actually go through Vermont Health Connect directly. And we're going to talk about what kind of options they have when they do go through the exchange directly, and how these options may interplay with each other. So there's one little pop-up here, if you could go to that, Morgan. So is an employer-sponsored insurance plan affordable? Apologize for the typo there, but basically, one of the things that we'll go more into is when an employer offers insurance to its employees, if it is not deemed affordable, quote unquote affordable, then the employee can go to Vermont Health Connect to receive, to see if they're eligible for subsidies. If the plan offered by the employer is deemed affordable, then they actually don't have that option. So the way that one would determine if what is offered from the employer is affordable is to use this calculator that we've linked here in the slide deck. So the one other thing that I'll mention is in the small business option, the first option, when the employer goes directly to the carrier to get a health insurance plan for a small business, starting this year, while the plan designs are the same, they actually will be, in most cases, different prices. So the prices may actually be a little bit lower when you're going directly to the carrier than when you're trying to purchase that plan through the market. So to make things a little bit more complicated, there are benefits to this, which we can elaborate on when we dive a little bit more in depth. So speaking of that, going directly to the insurance carrier. So here's what that looks like. The employer the employer would enroll directly through the insurance carrier. And in Vermont, we have two insurance carriers, Blue Cross Blue Shield of Vermont and MVP Healthcare. Employees cannot get the state and federal subsidies that are offered through the exchange. And again, the caveat here is if that employer-sponsored insurance, like I just mentioned, is deemed unaffordable, then they can get those subsidies. But assuming that the employer is offering affordable health insurance, then they cannot get those subsidies. The business can choose to offer any number of plans or insurance companies they want. So they could offer plans from both insurance companies. They could just choose to go with plans from one. They can offer several different options within one company, etc. That's really up to the business. The business can decide whether or not the plan is available to the employee only, or whether the plan is available to both the employee and the employee's dependents. The business can also decide the extent of employer contribution. So they can decide the amount that they want to contribute to the plan. They can also decide whether that contribution goes directly to the employee only or to the employee and the dependents. You can go to the next slide. So here's the QCERA, the option. So QCERA allows small employers to provide non-taxed reimbursement of certain care expenses. So this can go towards health insurance premiums, co-insurance, etc. And that can go to employees. So this is an option that employers might want to take advantage of. The caveats or the stipulations there are that they must maintain minimum essential coverage, which is a kind of a criteria that many plans on available meet. So you just want to make sure that the plan does in fact meet that, because if it didn't, it could be excluded from the QCER arrangement. The reimbursement that is offered through QCER can be used toward marketplace plans. So in Vermont, it would be Vermont Health Connect. So that reimbursement could be used towards Vermont Health Connect. The business must have fewer than 50 employees. This must be available to all full-time employees. So it can't be just, available to some employees, some full-timers and not all of them. And they can't offer a group health plan, small business health options plan, which is known as SHOP, or a flexible spending account. So again, there's a link here to learn more about this. Healthcare.gov does a pretty good job, laying out the details on this. You can go to the next slide.
And just to clarify for folks, when Zach says the SHOP plan, that's essentially option number one of these three broad options we're talking about. SHOP is another term for the small business enrollments when you sign up with Blue Cross and MVP as your business.
Perfect. Thanks, Sean. So I think Sean is going to go in a little bit more depth into some of the terminology and also the third option, which is enrolling directly through Vermont Health Connect. So Sean, I don't know if you want to take it from here and go over some of these key terms before, or if you want to come back to that after you go into the third option of Vermont Health Connect, but I'll turn it over to you.
Sean, before we dive in, there was a question that just came up, and I think it was around the previous slide. I'm unclear. Does the business or the employee need to maintain MEC? Also, how do strongly seasonal employees count in the full-time requirements? Should we cover this as we get to the end, or should we address it now?
Yeah, I can hit it now and hit on a couple of those things. So the requirement MEC, I'm guessing the person posting might be asking about the individual mandate, which is both a national mandate and also in Vermont, although there isn't a penalty associated with either, so there's sometimes some thoughts for confusion around that. Originally, under the Affordable Care Act, there was the individual mandate, and that meant that everybody had to have health insurance unless they had an exemption. There was a penalty associated with that. That penalty went away a few years ago. A lot of states put in individual mandates of their own after that. Some states like Massachusetts and others have penalties associated with it if you don't have minimum essential coverage. So to answer the person's question, is the mandate there is really on the individual. The individuals are required to maintain minimum essential coverage, but there isn't a penalty in Vermont. There is a question on I think the kind of middle ground they struck was because Vermont has done such a good job insuring its residents. We have one of the lowest uninsured rates in the country. I think the legislature and other stakeholders thought it would be onerous to stand up a penalty system, and so instead we continue to monitor the uninsured rate through the household health insurance survey, and also have a question on the personal income tax forms in Vermont, so that there can be so they can monitor the uninsured rate and reach out to people to make sure that they know about financial help for getting health insurance. And that was passed before the American Rescue Plan that we're going to talk about here, but it's fortuitous in that sense because health insurance is much more affordable now than it's ever been. Still expensive, obviously, and healthcare still is a huge expense for the state and for the country, but at least health insurance is more affordable than it's been in many years, and so to be able to get that word out to people. So that's the question related to the MEC. Before I forget the others, the HSA was asked about. And I guess as long as we're talking about terms, maybe can hit on that here. As I think as both Morgan and Zach said, this is the first kind of foray. We're going to talk about those three broad options. Zach and I, as Zach mentioned, are both best equipped to talk about the individual market for people who are buying health insurance on their own. For people who are thinking about offering health insurance as a business, we can have subsequent sessions, can bring in people from the insurance carriers, or we can bring in brokers, bring in others who certainly understand HSAs and HRAs and FSAs better than we do. But at a high level, the distinction between them is that a HSA is an account that's owned by the employee or owned by an individual. So you could be a sole proprietor and have an HSA. You could not have insurance through your employer and still have an HSA. The only thing you need to do is have a health plan that is compatible with that HSA, and they're noted on the Vermont Health Connect site or with Blue Cross and MVP. Typically the HDHPs, the high deductible health plans, also called CDHP, consumer directed health plans is what Blue Cross calls them. MVP calls them HDHPs. And they'll say that they're compatible with an HSA. And then you can then contribute to that HSA pre-tax. It's an account that you own as the individual, and you can pay those out-of-pocket costs with the compatible plan. And so that's the distinction between an HSA and an HRA and FSA, is that the HSA is owned by the individual. The HRA and the HSA, the HRA and the FSA are owned by the employer, and their reimbursements are made through the HRA. And we can get more kind of into all those details later or in a subsequent session. But the easiest way to set up an HSA would be to call either Blue Cross or MVP, and they can help. They have partners that they work with that set up those accounts. You don't have to go through either of them. I think you can go through a third party and still use it with one of their plans, whether you buy that plan through Vermont Health Connect or through the issuer. For these terms that we're talking about, and these are kind of, we probably did it a little bit backwards, right? This is the Health Insurance 101. We jumped right to the 400 level class of talking about HSAs and HRAs and Cruceras and FSAs. We probably should have started here in case there's folks on the call that were totally lost. The premium is what you pay each month just to have your insurance. And you'll sometimes hear us talking about gross premiums and net premiums. The gross premium is the full price plan premium that you would pay if you're not getting financial help, if you're signing up directly through an insurance company, or if you're paying, if the employer, if you're going through a small group plan. But that's what you have just to have the health insurance. And the co-payments and co-insurance and deductibles are what you pay when you actually use your healthcare. So when you see a doctor, you see a provider, you get a prescription, you might pay a copay. The copay being a dollar amount. Maybe it's a $5 copay or a $25 copay for seeing a specialist. But if it's a percentage you pay, that would be co-insurance. So it's together, they're both referred to as cost sharing, but copay is when it's a fixed dollar amount. Co-insurance is when it's a percentage. So you might have a co-insurance of 20%, which would mean that if you have a hospital bill of $1,000, then your insurance company would pay 80% and you would pay 20%. You'd pay a couple $100 on average. Deductibles are what you pay. Most people are more familiar with deductibles because we pay them for home insurance and car insurance and everything too, but that's what you pay first before your insurance kicks in. And there are some services that are covered before the deductible is covered. So the deductible will be waived for various services or prescriptions. And when you go to the plan comparison tool that we'll talk about or look at some of the plan designs, you'll see how the deductibles work with various services. The next couple terms here, the advanced premium tax credits and Vermont premium assistance. They're both types of financial help. The premium tax credits are a big one, and they can cover most or all of the cost of the premium for people with lower incomes, for people with moderate incomes, and now with the American Rescue Plan, even somebody going into a gold plan, making $80,000-$90,000 could have over half their premium paid by the premium tax credits, and people up to $105,000 would get, as an individual, would get some premium tax credits. So up until this year, they used to be more just people with kind of moderate incomes and lower, and now the vast majority of Vermonters are going to qualify for them. Vermont premium assistance, fewer people qualify for. It's not as big of a dollar amount, but it's about 3 times the federal poverty level. So that would be a family of 4 earning up to maybe $76,000 would get additional support from the state to lower their premiums even lower. And so it's about half, maybe just over half of the Vermonters enrolled as individuals would get the Vermont premium assistance, as well as the premium tax credits, with the vast majority getting the premium tax credits at least. And then metal levels breaks down to the types of plans that we'll talk about. There's bronze, silver, gold, and platinum. One piece of confusion, oftentimes people assume, oh, gold and platinum must be better plans. They're going to cover a lot more services. And actually that's not true. There's no difference. We can flip to the next slide. Is that where we, I think, hit on a little bit on the essential health benefits? We say here, all the Vermont Health Connect plans cover 10 essential health benefits. That's things like ambulance, emergency care, inpatient services, mental health, ambulatory care, physical therapy, occupational therapy, preventive care, care for maternal care, and the list kind of goes on there. And so it's the same services are covered by bronze plans as they are to platinum. The difference is that is how you pay for them. And so again, with the mix of how you pay for your healthcare being your premium that you pay each month, whether you use your health insurance or not, and your copay, co-insurance, deductibles, your out-of-pocket costs that you use just when you use care. That's where the difference is. On a bronze plan, you're going to have the lowest premium and you're going to have the highest cost sharing. On a platinum plan, you're going to have the lowest cost sharing, but you're going to have the highest premium. And the one exception, we always have the exception, is for people with lower incomes, up to 300% of the federal poverty level, but particularly up to twice the federal poverty level. So up to about $50,000 for a family, or $25,000 or so for an individual, can get cost sharing reductions, meaning they can get an enhanced silver plan, which are basically platinum-like plans, but at the premium of just a silver plan. So we'll go through. I'll bring that back up in a second as we flip here. And the big reference to this, what's different for 2022 is it used to be the people who were an individual, if you're earning $50,000, or a family of 4 earning $100,000, that would be the max you could earn and still get financial help. Now it's much, much higher. Individuals can earn up to $105,000, still qualify for tax credits. Family of 4 can earn almost $300,000, still qualify for tax credits. So you're talking about virtually all Vermonters there on the family side. On the individual side, well over 90%. Maybe we're not talking about the 1%ers, but certainly over 90% of Vermonters there. And a second piece is changing is that who people pay their health insurance bill to is changing. It used to be that you paid Vermont Health Connect. Vermont Health Connect would pay Blue Cross and pay MVP. And certainly in the early years after the Affordable Care Act, that was the cause of a good bit of the problems that folks encountered, was where the bill payment went and how it got to the issuers. And it was one of the reasons that a lot of people who weren't getting financial help enrolled directly with the insurance company. And that made a lot of sense if you weren't getting financial help, to just enroll directly with Blue Cross or MVP, get to deal with them directly. Now,
Sean, sorry, I just want to lift up just so, because it was news to me, right? In order to receive these tax benefits, you have to go through Vermont Health Connect. When
Yep.
we talked to some business owners earlier, and when I've connected small businesses who've gone directly to the carrier, when they've done this new cost estimator, it's saving them thousands of dollars because they're going directly through the marketplace. So I just wanted to make sure you lift that up.
Yeah, that's exactly right. Yeah, thanks for underscoring that, Morgan. And yeah, that's the bottom line to this slide. We could have left off a lot of those words and said that, but yeah, Morgan's exactly right. People who enroll directly but at the beginning of the year, there were about 7,500, maybe 1,000 have moved over to the marketplace. You don't have to wait for 2022. You could do it today. You can call up Vermont Health Connect if you are directly enrolled with Blue Cross or MVP. And that may well be the case. So here, it may have made sense for you last year. Say you're an individual earning $70,000 or $80,000. There would be no reason for you to enroll through the marketplace. And maybe you also had been enrolled before and had a bad experience with bill paying and wanted to pay the insurance companies directly. So now you can kind of have your cake and eat it too. If you can have that higher income, still get a tax credit, and get to pay the insurance company directly. But as Morgan said, you have to transfer your plan over to Vermont Health Connect because that's where you'll get the form that you need for the IR when you pay your taxes next year. And I think I saw a question pop up before on the chat. There's been a few here coming, or I believe somebody asked about the tax credits, how you get them, right? Somebody said is the tax credit applied at the beginning of the year or at the end of the year in tax filing? So you actually have your choice as an individual. You have to be enrolled through Vermont Health Connect. And most people elect to get it each month as a discount on their bill. When you apply, and you give the income, and you give your income, you get verified for what your income is, you might qualify for $500 tax credit per month. And most people decide to take that $500. Say they're in a plan that costs $700, they'll take that $500 off. They'll just have a net premium of $200 per month. That's all they'll have to write the check to their insurance company for, is $200 a month. Other people, particularly a lot of sole proprietors, who think their income maybe is going to be $70,000, but there's a wide range. In a good year they might be over $100,000, and in a bad year maybe they're at 30 or 40, and they don't want to risk taking the amount of tax credit that they would get for earning $70,000 and then find out at the end of the year when they file their taxes that they earned $100,000 and their tax credit is much less. So they may choose instead, they qualify for $500, but they only take $200 as a discount each month. And that ensures them that they'll take part of that discount, have a lower bill each month, but then when they file their taxes, they'll get a bigger refund back as well, even if their income turns out to be higher. So that's up to you. Some people also want to fill out the shorter form. They don't want to fill out the longer application with their income and things. And as long as you sign up with Vermont Health Connect, if you don't give that other information, you can't get that advanced tax credit as a discount. But as long as you're enrolled through Vermont Health Connect, you'll get the tax form in January saying you were enrolled for July through December, and then you'll be able to get 6 months worth of tax credits when you file your taxes. So there's different reasons people may choose one path or the other, but the short answer is you can do it either way. You can take it in advance or when you file your taxes. I think we can flip to the next slide. Yep. So here, it's kind of where to get started. You can either call the number there, 855-899-9600, if you want to talk to a person. We're in open enrollment now, so they're open 8 to 5, Monday to Friday. Rest of the year is 8 to 4:30. But on the website here, I think if you click, Morgan will get, I think it'll show 3 kind of links to call out here. One is the plan comparison tool. That's where I highly encourage people to go. If you're wondering about plan selection or options and meta levels, all these things, you're not sure which plan is right for you, just click on that picture of a shopping cart. It'll take you to a tool. You can put in your age, some other information we'll show in a second. The second piece is that American Rescue Plan Act that's highlighted. That goes to a link that has a lot of more information about the American Rescue Plan and what it means for people who get their insurance through a small business, people who don't have insurance, people who are already enrolled, and various other benefits there that folks can know about. And then third, at the bottom there, we're here to help. Again, that phone number I mentioned. There's also in-person assisters, and they work in all 14 counties. If you click on that link, or if you call the number, we can connect you to somebody in your county who can talk about the plans, and they're often associated with hospitals and clinics. They help their customers. I think we can click to the next link here. As I mentioned, that shopping cart, if you click on it, as I mentioned, I just had a few questions. You can answer them in a couple of minutes. It's not going to be precise as filling out a the full application, but it'll give you a pretty good estimate. You can put in your age, you can put in your health if you're saying it's good or poor, if you have any medical procedures. If you want to leave those blank, you can, and it'll just give you what the average person of your age might expect for for health needs and prescription needs over the course of the year. And then if you want to help paying for coverage, number of people in your household, again, that important question of is employer coverage available to everyone, that'll indicate if you'll be qualified for the subsidies. And then you can click to the next slide, Morgan. Once you put in your household income and click to see your estimated help, it'll tell you these 2 types of financial help. One is the premium subsidies that we talked about there, the premium tax credits and the Vermont premium assistance. So this is an individual who was earning $38,000. They can get $613 per month between the premium tax credits and the Vermont premium assistance. And it'll say that they qualify for Silver 73. And so if you have qualify for Silver 73, or might say Silver 77 as well, those mean that you're getting, if you buy a silver plan, it's going to be more like a little bit more like a gold plan, like in between a silver and gold plan. Your out-of-pocket costs will be lower than they would be with the silver plan, but you would be paying the silver premium. And if you see, as we see there, you see in bold, however, you might find a gold or bronze offers a better value. If you see Silver 73 or Silver 77, don't necessarily jump to saying, oh, I got to pick silver. You'll want to click this continue link and go on. But if you see Silver 87 or Silver 94, that's for people whose income is a little bit lower. If you see Silver 87 or 94, your decision just got a whole lot easier. Like you can get a silver plan for under $10 a month, and it's going to have really low out-of-pocket costs, lower than you'd have with a gold or platinum plan. So if you talk to any of your employees or they're buying and they want to know about that, if they see Silver 87 or 94, silver's the easy choice. We can click to the next slide here. For people who don't have as easy of a choice, you'll see that there are a lot of plans. There's 26 plans. There's 13 plans from each issuer. A couple more. If you're under 30, you can choose a catastrophic plan. Although I'll flag for the catastrophic plan is that you'd have to have a really high income to have a catastrophic plan cost less than a bronze plan, because you can't use subsidies on catastrophic plans. And since so many people qualify for subsidies now, they'll usually bring down the cost of a bronze plan lower than catastrophic. But this example we gave, I think we said the person was 45, so they wouldn't have catastrophic plans come up anyhow. You see up at the top where it says sort by and cost in an average year. So that's that middle row. And an average year is where that age comes into play, because again, the premium doesn't matter, your age, your health status, none of that impacts what your premium is. You'll see on the upper left here, that top plan that somebody can get, and that's $0 per month for a monthly premium. So if you're earning $38,000, there'll be multiple bronze plans you could choose that would have $0 per month. And that may seem like a good way if you're not going to need any health insurance. But as you can see, in an average year for somebody who's 45, they're going to have some medical needs, and a bronze plan is going to have a lot of out-of-pocket costs. Could be $3,000 a year, and in a really bad year where they hit their maximum out-of-pocket, it could be nearly $8,000 there, and some of those plans even more than $8,000. Again, having $8,000 a lot better than having $100,000 or what you could be in debt if you don't have insurance at all. But there are other plan options that would give you a lot more protection at the other metal levels. If we click to the next slide here, you'll see you can go up. But this one, if they choose premium, and so this wouldn't be the top of the premium, it would be scrolled a little ways down, because as we saw, that same person had plans that would cost $0 per month, that would have the lowest premium. But as you can see with that silver plan, they might be paying $120 per month. In that case, again, their average year. Zach had this one up. Is this the same scenario, Zach? Still the $38,000?
It's the same scenario, and I think where it's sorted, not only where you can see is in the left navigation, you can also sort by deductible.
Yep.
So this one I think is filtered by both the premium, but also a deductible that doesn't go over $2,500, which is I think why you're seeing it displayed the way it does.
Okay. Yep. No, that makes sense. So you can see with these, with these tools here, you can filter it in different ways. You can see that they unchecked the bronze box here, so they're only looking at silver, gold, platinum, that they have the deductible set. And if you only want to use one insurance company, you could check on that insurance company if you've had particularly good experience with one. If you want to dig deeper, you can click on the blue titles of any of those plans. So the MVP, BT, Gold 1, you could click on that and it'll give you a lot more details. You can go right into the insurance company to see their network, to make sure the doctors that you like are in their network. You can go to their prescription formulary to see if there's drugs that you use on a regular basis, to see how they would be treated by that insurance company, by Blue Cross or an MVP. So it's a useful tool all the way around for getting started. And we can click to the next slide. You want to flip back to here, Zach? Talk about the dates.
Yeah, thanks, Sean. So, and I'll try and I want to leave some time for folks to ask questions. And I think hopefully, actually, a lot of the answers to questions were actually embedded within Sean's presentation. So hopefully that helped answer some questions. But we just wanted to make sure before we ended that we highlighted some important dates for you that are happening right now. Sean mentioned open enrollment, which is the time of year when folks can enroll in or change a plan without any other conditions. So from November 1st to January 15th, which is extended this year, is our open enrollment period where you can make these changes. So what's really important to know about this though, however, and you can see we highlighted the December 15th date, that's the last day of open enrollment to choose a plan that begins on the 1st of January. So even though open enrollment goes a month longer than it has in years past, if you want to plan or your employees want to plan starting January 1st, they need to make that plan selection and payment, I think, to effectuate, right, Sean? They need to effectuate by the 15th as well. So they'll need to do all that and enroll in the plan by the 15th. So they can still opt in to get a plan for 2022 until 1/15, January 15th, but that plan wouldn't start until February 1st. So just some important things to keep in mind when you're choosing a plan. You know, folks can get into the exchange at other times of the year outside of open enrollment, but they require a qualifying event, which is a variety of things that allows them a special period. It's called a special enrollment period, where they can join outside of open enrollment.
Yeah, and Zach, on the effectuation, so when people sign up and apply and select a plan, they then get their bill, and they have 21 days from the bill under state law to pay their bill. So ostensibly, you could wait until December 15th to sign up, and then you would get the bill, and you technically have into January to pay it 3 weeks from December 15th. But we encourage people to pay earlier, to sign up and pay earlier. The reason being that after you pay is when you're going to get your insurance card and be effectuated. So if you waited to December 15th to sign up, and then you didn't pay on December 15th, you waited till you're 3 weeks out, and you needed healthcare on January 1st or 2nd, you'd be able to get it and you'd be reimbursed by it. But your insurance company wouldn't have that information because you hadn't paid yet. You wouldn't have your card yet. It would just be a lot more, red tape with your provider, with your doctor, and you'd eventually get reimbursed there because you would have coverage. But it's just easier to sign up and pay and get your card before the first of the year.
So you can go to the next slide, Morgan. So really quick, on our website, on our homepage, the Find Local Help button and the Learn More button are great places to start to launch you into more information about what we've talked about today and how to get more help. Again, our assisters and our resources. If you go to the next page, Morgan, what we've put together is a kind of list of educational materials around health insurance. We also have educational materials around open enrollment, and specifically, and like Sean mentioned, the American Rescue Plan Act. So there's lots of information. That being said, always feel free to reach out with questions because it's a lot to navigate. So I think that gives us a little bit of time, hopefully, to answer some questions or clarify some things that came up during the presentation.
Great. Yeah, and I see one from Andy Jones there too that we didn't have. I could jump into that, Morgan, briefly. It is a good question. Andy had asked if the higher subsidy rates will continue indefinitely or if they'll sunset in the future. And that's something that we thought we might have news as of a couple of days ago, but when Congress split the infrastructure bill with the Build Back Better, it's I guess we'll have to wait a couple more weeks to find out, because under the American Rescue Plan Act, these subsidies were good for 2021 and 2022, so set to sunset in 2023 at the end of next year. And one piece of them, there was an extra, we didn't talk about here, but an extra benefit for people that had gotten the unemployment compensation in 2021, get additional premium tax credits. And that piece sunsetted at the end of 2021. But the portions being tax credits for more people who hadn't gotten them before, and more generous tax credits for people who are already getting them. Those two pieces continue through the end of 2022. The Build Back Better bill, the version of the bill that had gone through the House, had them being extended, I believe, until 2025 or 2026, and also had one more year of add-on for the unemployment compensation piece. And again, we'll have to see how that moves. But that's something we're looking at. And we were also looking and talking a lot with the congressional delegation about what's called the family glitch and the issue with people that have an offer of insurance. And this was one piece that Zach talked about earlier that I wanted to make sure to underscore, was if as a small business, you're deciding that, as Zach said, you can decide whether to offer the insurance just to the employee or to the family, whether to make a contribution toward just the employee's insurance or to the family's insurance. It's something I think a lot of businesses with the best of intentions think, okay, I'll contribute to my employee, and I want to make sure the employee's family has access to the health insurance too. In many cases, the family would actually be better off if you didn't offer them insurance. If you were offering insurance and offered it to the employee, but if you weren't making an offer to the rest of the family, that would allow the rest of the family to go through the marketplace and get subsidies. And we do hear a fair bit from people whose spouses aren't able to get health insurance because they would have to pay full boat. There's no contribution for it, but they also can't get subsidies because they have an offer of it, and the offer is deemed affordable because the affordability criteria is just based on what an individual's contribution would be for a one-person plan. So that was something that was called the family glitch. It was an error problem in the original Affordable Care Act. We're hoping it'll be fixed, and it may be, but that's something we're staying tuned to as well.
And Sean, I can try and piggyback off that for Karen's question, which is a great question. I think to just kind of piggyback off what Sean said, there are going to be cases, while we can't tell you which way to go, there are going to be cases where it may feel like a better choice to go to the market, and that everyone has more affordable options through Vermont Health Connect. And certainly in 2022 with the, enhanced subsidies, we've seen a drastic change in affordability for folks. I think what's complicated here is that there's a few factors in play, and it depends kind of the way in which you go about the business to make that decision. So I feel like we can't necessarily direct you one way or another. Is it definitely better? But I think that I would say it's certainly worth considering. And Sean, I don't know if you have anything to elaborate on there.
Yeah, I think on that, and at this time, I think as Morgan said too, this is, that kind of decision about whether to, to drop and let their employees go is something that's, probably a bigger panel and a good focus in its own right for an event that we could follow up. I think a lot of those considerations, we may want to bring representatives of the insurance companies into a panel as well. Certainly, you can talk to them. Well, there's also considerations from the Vermont Tax Department. We could bring in folks from Department of Tax to talk about the employer assessment, which is a fee that if employers don't offer insurance or have employees that don't get insurance. So it would be a pretty complex formula to do the math. But in many cases, employees would be better off if the company didn't offer insurance. But it's likely going to be a split on income. If you have a small law firm, likely a lot of the lawyers will be better off with you offering health insurance, and maybe more of the the clerical staff would be better off if you didn't offer health insurance. And so it really comes down to each business, and talking to either a broker or doing some of the math is something that that we can have further conversations about. And I think the other piece too, I think, is that we've heard from a lot of small businesses too, is that a question we actually were just referring to about whether it's going to be sunsetted. Whereas even if you've done the math and you decide that it would make sense to drop insurance and not offer it to your employees, you don't want to like flip around again next year. It might be a hassle, to change it all and then change it back next fall. So I think some businesses are keeping their eye on what comes out of Washington, and if it is extended till 2025 or 2026, then that makes their decision easier. If it's just going to be for one more year, I think a lot of businesses think we just keep offering it and keep that continuity.
I want to be cognizant of time because we only have 2 more minutes left, but and so if people can stay on, I mean, I don't know, Zach and Sean, do you have a few extra minutes so we can try to get through these questions and then share the recording? But to follow up on Karen's question, if a business drops their plans, if we could do this sort of quickly, and I don't know if it's a quick answer, can they still make a premium contribution to their employees? Is that where like a QCER option could be picked up, but they're still going through the marketplace to receive those subsidies? Is that a pivot that's optimal?
Yeah, it is an option. There's considerations for that too. I think there was a question above, actually. Section 20 asked, can an employer apply assistance through Crucera and fund the HSA account? On those, on Jen's question there with the Crucera, there are some Cruceras that are compatible with HSAs from how I understand it. Again, as we talked about, the HSA is owned by the employee, and it's for expenses they have, and the health reimbursement is the reimbursements they get. So I don't believe that Crucera funds the HSA per se, but there could be an employer that has both of them, and either a broker or one of the insurance issuers, I think, would be able to talk through which types of Cruceras are compatible with HSAs. And again, the HSAs would have to be paired with the high deductible health plan. On the question of making the premium contribution to their employees, that's certainly something. I think when Zach talked about the kind of 3 very broad options, there is overlap between those 3, but certainly with that option 1 being offering health insurance, largely where Zach was saying with that second option being with the Crucera, that would be not offering health insurance, but offering a Crucera. And so your employee is benefiting from the Crucera that way. And then your employee could go through the exchange and get subsidies. Now, I will underscore too that if you are making a contribution to the employee through a Crucera, there are questions, and that comes as part of the IRS's kind of analysis too. If people are asked if they had a Crucera, if you had a Crucera, you wouldn't get as generous of the tax credits as if you didn't have a Crucera. So there's no kind of easy way around I think we've talked about too. Some thought instead of doing a Crucera, you give people a raise, then they have higher income, they'll get lower tax credits and have more income tax to pay. But it is a big kind of math equation across. And I think when we have more than -1 minute, we can delve into more examples. And again, brokers or payroll companies, others that you work with may be useful resources on figuring out that decision.
I have one question from Leda at Dosa Kitchen. Is the QCER an option for sole proprietors? Sorry.
Yeah, that's a great question. One I think we'll have to get back to you on that, or ask the insurance issuers. It typically, I would think not, in the sense that sole proprietors usually don't have small pieces if they come through the marketplace. And a Crucera, again, would be owned by the company, but whether a sole prop could set that up as owned by the company, we'll check on that and circle back.
Okay.
And then the question I see here from Maddie, that's a great question. If you want, there's probably I don't know, Las Vegas probably has some odds out there on whether the Build Back Better bill gets gets signed into legislation before December 15th. I know the congressional leadership and the White House say they want it done by Thanksgiving. Whether I would put money on that, I'm not sure, but that's what it comes down to. We'll find out when that legislation passes. That's when it will be a done deal. So it may be before December 15th, but there's certainly a chance it might not pass by then.
I believe we've gotten through most of the questions. Does anyone want to come off and ask any question, come off of mute and ask any other additional questions? That was a lot of information. But I actually would love to hear from everyone. If we were to schedule a second meeting, what would be most helpful in this moment for you, as you absorb what we've taken, what they've presented right now, and kind of how you navigate the next steps? What would be most helpful? Throw it in the chat or come off of mute. And I apologize to everyone. I lost my voice this weekend somehow, so sorry for the raspiness. A comparison of real world examples of businesses who have gone each of the possible directions. Cynthia, I appreciate that. I'm a visual learner, so it's really hard for me sometimes to absorb and then just, make the best decision, best next decision. So if it's possible to do that, that would be helpful, to understand what works and what doesn't. Okay. What else? Would it be helpful to have a meeting with the Department of Taxes or Financial Regulations, or bring in Blue Cross Blue Shield or MVP?
So I would just, Morgan, just two things that to kind of answer some of the comments. So I think for the staff who struggle to pay the employer's sponsored insurance that's offered, they should definitely make sure it's affordable, because that would be, if it were not affordable for them, then they would be able to come into Vermont Health Connect and access those subsidies. So that affordability calculator on the website is an important tool. The other thing that can kind of get at something similar is I really would plug just playing around with the plan comparison tool. There's a ton of information there. And I think that, you can kind of play around with different income levels and different plan options, which I would highly recommend. It's really, even though it's not necessarily designed specifically for small business, it can really allow small business owners and employees what kind of options they would have should they be in a scenario where they would come directly to the market. So I would just plug those things out. And that might also trigger some follow-up questions. I see that when I plug in this and this, I get this option. So what does that mean? How would I make this change? What would I have to do in order to see these benefits?
Yeah. And Karen's point here that she posted, I think if we do another edition and share some real examples, I think having a panel with some actual businesses, we can connect with Morgan and others. I'm guessing many of you have deliberated, and many of Main Street Alliance's members may have gone one way or the other and could talk about these. But we can also share some examples to show what it would look like for cost for employees, particularly some of the lower income employees, how they're impacted by your decision, as we talked about before, to offer insurance or not, to offer it to whom and to not, and what percentage to contribute. And those decisions of how much you contribute and to whom, as Zach was just saying, will impact who passes the affordability test and who doesn't. And as Karen posts here, offering the bronze plan can mess up affordability is exactly that, because the affordability test is based on the most affordable, the lowest cost plan, what percentage of your income that is. And for 2021, it was 9.83% of an individual's, the cost of an individual plan compared to the household income. For 2022, it'll be 9.61%. But what that means is, if, as Karen was saying, if she only offered silver and gold, then it would be a higher threshold plan. People that could afford that silver or gold plan would be paying less than 9.61% of their income for it, and they would be getting a plan that would have somewhat lower out-of-pocket costs. Whereas if she were to offer a bronze plan, and even that bronze plan was going to cost 9.5% of their income, it would be deemed affordable, but then they would have all of those out-of-pocket costs on top of it. If she only offered a silver plan, that person who would cost 9.5% of their income for the bronze plan, maybe a silver plan's 11 or 12%, so it would be deemed unaffordable. They could go get subsidies from the marketplace. People with higher incomes in her company would be able to get that employer-sponsored plan, and it would kind of be the best for both sets of employees.
And one of the things that we wanted to do in this meeting is to be able to also show for those folks who aren't able to, either because they're a smaller shop, but they don't offer health insurance, but to be able to also show these resources so that you can see what the assister program looks like, the expense navigator, the cost, the calculator, being able to show those resources to your employees so that you can help them access health insurance as well. Because we know that there's a lot of folks who, in this last year have either fallen off or aren't aware of all of the new subsidies that are available to them. And it's really, this is the moment for them to get into the system. Andy, is there a scenario where a small business with nearly all employees, everyone earning under $25 an hour, isn't helping employees more by putting any additional business resources into wages? This would be a great example for another meeting.
Yeah, that's a great question, Andy, and we can look into some of those scenarios too and share at the next meeting. I think to Morgan's point, and as Zach set up at the beginning, kind of our wheelhouse at the Department of Vermont Health Access is running Medicaid and running the marketplace. We have materials. We should have mentioned, maybe Zach did, but a open enrollment communication toolkit with some sample articles, some posters. If you could, if you want to share the word to your employees, if you don't offer health insurance, to make sure they're aware of this additional financial help and how to get to the plan comparison tool. Some of those resources would be great to share with them. The other side of it, as far as the business decision, that's a little bit outside of our wheelhouse, but we're happy to put our heads together and do the math on some of those scenarios, like Andy raised there with the employees at $25 an hour. So we're happy to put some pen to paper, come up with some of those examples for the next session, and bring in other folks too. I think it could be, I'd love to hear from other businesses. Really, I learned, it's a chance for Zach and I to learn from a lot of you and what goes into your decision making, and we're happy to help where we can as well. If we put all our heads together, maybe we'll come out with a good result.
Great. Well, we will be sure to send out a follow-up communication with all of the resources linked here. We'll probably turn the slide deck into a PDF with all of the links that are interactive. We'll continue to work with the Department of Vermont Health Access to get communications out to all small businesses during open enrollment. And we'll put our heads together about what a follow-up meeting could look like. And if anything, and I'll put it in the chat, streetalliance.org, and I will follow up with you all via email, but this is my email. If you want to get in touch with me directly, I'm happy to put together a follow-up meeting. So thank you all so much for joining in today. And yeah, if you have any further questions, please don't hesitate to reach out. And Zach and Sean and Sven, I'll stay on for a few extra minutes.
Sounds great.
Thanks for having us.
Thanks, Andy. Thank you all.
Thank you.